Some women are unable to get pregnant, and behind this reality lie many medical, hormonal, emotional, and lifestyle-related reasons that vary from person to person. But today we will deeply explore all the possible causes that can prevent a woman from becoming a mother. Starting with hormonal imbalance, which is one of the most common reasons for infertility worldwide, and the most frequent disorder is PCOS, or polycystic ovary syndrome, in which the ovaries develop multiple small cysts that interfere with the natural balance of reproductive hormones and result in irregular or completely absent ovulation, making conception extremely difficult. Symptoms like acne, excessive facial hair, weight gain, and irregular periods being quite common, in addition to which thyroid disorders also play a major role in female infertility. Whether it is hypothyroidism, where metabolism slows down and the body becomes sluggish, or hyperthyroidism, where everything speeds up unnaturally, both of which can disturb ovulation significantly. And then there is the issue of elevated prolactin levels, which can suppress the ovulation process and prevent the release of an egg due to problems in the pituitary gland. All of which can be detected through blood tests and treated with proper medication under medical supervision. Then there is the matter of irregular ovulation, or complete absence of it, known as anovulation, which can be caused not only by hormone problems, but also by stress. Excessive physical activity, being severely underweight or overweight, all of which disrupt the delicate hormonal communication that is needed to release an egg every month. And these issues are often treated with ovulation induction medications, such as Clomid or Letrozole, that help stimulate egg release, provided the rest of the reproductive system is functioning properly. But even if ovulation occurs, the path that the egg travels through, known as the fallopian tube, can sometimes be blocked, preventing the sperm from reaching the egg in the first place. And this can be due to past pelvic infections, surgeries, or a condition like genital tuberculosis, which is surprisingly common in South Asia. And to detect these blockages, a test called HSG hysterosalpingography is performed, where a dye is passed through the uterus to check whether the tubes are open or not. If they are found blocked, surgery might be considered to clear the tubes, or if the condition is serious, IVF in vitro fertilization is often recommended. And now, speaking of the uterus and cervix and the environment where the baby will grow, even here, we find conditions like fibroids, polyps, or structural abnormalities like a Baker Newitt or septate uterus, all of which can prevent implantation or cause early miscarriages. And thick cervical mucus can act as a barrier against sperm entry, which can also lead to fertility problems. And tests like pelvic ultrasound, hysteroscopy, and even MRI scans are done to detect such structural issues, and depending on the issue, treatment may involve hormonal therapy or minor corrective surgeries. Now, moving to a crucial factor, age, because female fertility is not constant. And after the age of 30, the quality and quantity of a woman's eggs begin to decline slowly. And after 35, the decline becomes more noticeable. And by 40, natural conception becomes significantly harder, and the risk of miscarriage and chromosomal abnormalities increases. It's making timely family planning extremely important. But not all cases of infertility have a known cause. Sometimes all test reports are completely normal, yet a woman is unable to conceive despite regular efforts for a year or more, and this is termed unexplained infertility. And while frustrating, it is not uncommon. And in such cases, procedures like IUI, intrauterine insemination, or IVF are often successful. Now, apart from medical reasons, lifestyle and health factors also directly influence fertility in major ways, with obesity leading to insulin resistance, and hormone imbalance, and being too thin causing periods to stop altogether. Excessive stress interferes with the brain's hormonal control centers and disturbs ovulation, while smoking and alcohol degrade egg quality and reduce the chance of implantation, even affecting male fertility negatively. So both partners need to live a clean, healthy lifestyle, which includes a balanced diet with leafy vegetables, fruits, nuts, whole grains, and good sources of protein, while avoiding processed junk foods and sugary drinks, as these all mess with hormonal function and a consistent sleep schedule is equally important, since irregular sleep patterns disturb hormone levels too. And natural tips to improve fertility include moderate exercise, yoga, meditation, acupuncture, and even herbal remedies like maca root or shatavari. Although these should only be used under professional advice and to increase chances of conception, women can track ovulation using apps, basal body temperature charts, or ovulation predictor kits, LH kits, to-time intercourse correctly, and if a couple has been trying for a year or 6 months in women over 35 without success, it's time to see a fertility specialist, who will usually begin with basic tests like hormone profiles FSH, LH-AMH, TSH, prolactin, pelvic ultrasound to evaluate ovaries and uterus, HSG to assess fallopian tubes, and semen analysis for the male partner. Since sometimes the issue is not with the female, but with the sperm, such as low count, poor motility, or abnormal morphology, and depending on what the tests reveal, treatment is customized. Sometimes just correcting thyroid levels or reducing weight brings back natural ovulation, while in other cases ovulation induction drugs are used, and if the issue is with tubes or age, then assisted reproductive technologies like IUI or IVF are employed. Where in IVF, the woman's eggs are fertilized with sperm in a lab, and the resulting embryo is transferred to the uterus, offering high success rates, especially for blocked tubes, advanced age, or poor sperm quality. And for those whose eggs are no longer viable, donor egg IVF is also an option. And in rare cases where carrying the pregnancy is not possible, surrogacy can be considered. While adoption also remains a beautiful and loving path to parenthood, but beyond the physical challenges, infertility takes a heavy emotional toll, especially in cultures where childbearing is socially expected, and women often face shame, pressure, and guilt. Despite the fact that infertility is a medical condition and not a personal failure, which is why emotional support, counseling, and community understanding are so essential in this journey. Couples should stick together and avoid blaming one another, because more often than not, the cause is either shared or unknown. And treatment outcomes improve significantly when the couple works as a team, emotionally and physically, and we must also spread awareness that infertility is treatable in most cases thanks to advances in modern medicine. And many couples who once thought they could never have children are now parents because they sought help at the right time. So it is very important not to waste years relying solely on natural hope. If a year has passed without success medical, help should be sought promptly. And finally, the most important message is that there's always hope. Because motherhood is not only about biology, but also about love, patience, and strength.
Ow.
And whether it's through natural conception, treatment, IVF, donor eggs, surrogacy, or adoption, there are many paths to becoming a mother. And every woman deserves that chance if she desires it, because with timely diagnosis, healthy choices, and the right support, most infertility journeys can be turned into success stories. So if you or someone close to you is struggling with this issue, don't lose hope. Take the step. Seek the guidance, and remember, infertility is not the end. It's a challenge that can be overcome with science, support, and strong will.